Okay, hang on. Okay. Let me know when. Okay. Hi. So, you know me. I'm Alison Chandra. I am a pediatric nurse, and I'm also the mother of a medically complex child. And like so many of us, I've had to learn this advocacy alongside the medicine and the sort of technical bits and pieces of his condition. I've also had to learn, for me, how to advocate for him, and like Monica was saying, how to encourage him to advocate for himself. We're going to talk about sort of the dark underbelly of something that can happen when we are trying to advocate for our kids. We've all heard about it. We kind of talk about it, but we don't usually address it formally. And so let's address it formally. Medical gaslighting. What does it look like? And how do you respond to it if it happens to you, so that you can get your kid, or yourself if you're the patient. Again, the goal is to get these kids to the point that they're going to advocate for themselves, the care that they need. So the term gaslighting, backstory, comes from a British play that was first performed in 1938. It was adapted into a film version. That's what this poster is from. It's set in London, and the plot centers around sort of a seemingly gentlemanly man who marries a rich heiress and then uses lies and manipulation to convince her that she is crazy so that he can steal her money. The title comes from this scene where he turns the gas lamps on in one part of the house, and so they dim in another part of the house, and he tells her, no, they're no dimmer than they were. They're shining just as brightly as they ever had been. And he does this over and over until she starts to doubt her own reality. Gaslighting, okay, if you know me, and I know my dad does, and I know he knows about the giant dictionary that I used to read for hours on end, I turned to my friend Webster. It's not the OED, but it's what I had available to me. Did you know the OED wants a subscription to just look up words online? Unbelievable. Anyway, gaslighting is termed as the psychological manipulation of a person, usually over an extended period of time, that causes the victim to question the validity of their own thoughts, perception of reality, or memories, and typically leads to confusion, loss of confidence and self-esteem, uncertainty of one's emotional and mental stability, and a dependency on the perpetrator. Got it all? Okay, that's long. It's complicated, and it doesn't necessarily speak to medical gaslighting, which is what we want to talk about. So Webster also helpfully gives us a second definition. Gaslighting is the act or practice of grossly misleading someone, especially for one's own advantage. Okay, so here's where we're getting into the crux of it. And this is where you're probably going to be able to start drawing connections between experiences you've had and this terminology. It's not always going to be clear what this so-called advantage is to the provider or the person who is gaslighting you when it's happening. They might be trying to protect their reputation. They might be trying to protect the reputation of their institution. They might just be unwilling to admit their own limitations or their own fallibility as a human. It's always uncomfortable to say, I don't know. But regardless of the reason behind it, medical gaslighting gets in the way of better clinical outcomes. When it comes to advocating for yourself or for your child, it is important to be very clear about what is medical gaslighting and what isn't. This is not a term that we want to throw around willy-nilly and call everything medical gaslighting, because that's going to do more harm than good. It's important to be able to recognize it and to call it out when it's happening and to work against it. It's also important to recognize when that's not what it is, because your strategies for dealing with situations are going to be different, if that makes sense. Okay, so what is medical gaslighting? It's when a provider's words or actions consistently, you're going to hear me say this a lot, dismiss, minimize, or deny valid concerns that you have, specifically in a way that undermines your confidence or delays care that is necessary for your child. Medical gaslighting is shifting of blame. There's often a blame shift with this, pushing blame onto the parent or the caregiver instead of investigating what's going on and saying things like, oh, that's not possible. You can't be seeing that. This isn't happening. when you have literature, documentation, proof that something is happening. The gas lamps aren't dimming. They're shining as bright as they ever were. No, they're not. I can see it with my own eyes. Or repeatedly attributing new symptoms or worsening symptoms to, it's just your anxiety, mom, without actually evaluating. It's not simple miscommunication. Okay, we hear this term gaslighting. Don't gaslight me. We hear it's in common parlance, so it's important to know what it's not. It's not just a miscommunication that your provider is willing to talk about and clarify and get to the bottom of. That's a miscommunication, not gaslighting. It's not a knowledge gap that a provider is willing to admit to and work to fill. Again, your providers are humans, and they're not going to know everything. It's okay for them to say, I don't know. It's okay for you to bring something up to them that they didn't know. It's their response to it that kind of determines which path we're going down here. A misdiagnosis is not necessarily medical gaslighting. If they're actively reevaluating things as you have new symptoms coming up, even if that misdiagnosis was kind of a while ago, if they are still moving towards figuring out what's going on, you're not being gaslit. Sometimes kids get misdiagnosed, and it's not someone's fault, and it's not on purpose. It's also not systemic issues that are outside the provider's control. Okay, so scheduling, not being able to get a kid in for a procedure or a test, miscommunication, things like this, that's happening at a systemic level. That's not your provider gaslighting you. That's a problem with the system. I want to tell you a story. Julie is a friend of mine. Olive does not have heterotaxy, but I think her story is so perfect and, well, not perfect, let me be very clear. But it's very telling and to show kind of what we're talking about, an example of it, and then we're going to talk about how we recognize it and how we fight it. Sound good? Olive, when she was a newborn, she contracted HSV-1, which ultimately led to encephalitis and meningitis, resulting in a diagnosis for her of cerebral palsy. When she was 7 months old, Julie started noticing that Olive was getting really stiff and rigid during feedings, and really irritable. She was arching her back almost constantly, like just in this position, this backwards C shape. Julie brought her to the pediatrician, and they were very concerned. Initially very concerned, she's maybe developed seizures, this could be a seizure disorder. They life flighted her over to the Children's Hospital in Arkansas where they live. So far, so good, right? Identified problem, acted accordingly. Now the gaslighting starts. For the next almost 2 weeks, Olive was impatient, and Julie was pushing for answers and just constantly got pushed to the next team. Well, I think it's fine. I don't think anything's wrong. These are quotes from doctors. This is just the way she's going to be. Julie tells the doctor, no, but this is I can only feed her when she's in this position over my legs. Like, what's happening? This is just how it's going to be. You're just going to have to figure out a way to live with it. But Julie knew that something was wrong, and she was discouraged over and over from seeing ENT. She knew somehow that there was something going on. She needed to see an ENT. She ended up curbsiding the ENT doctor, who turned out to be like the head of the department. She found him in the hallway and said, I need you to come and look at my kid. ENT took basically one look at Olive and said, she needs a supraglotoplasty. This is an airway issue. Julie went back to the team and said, well, I've talked to ENT, and this is what we need to do. And they said, no, absolutely not. That's not what it is. If you push for your kid to have this surgery, she's going to end up in the PICU, and you will have been the one that killed her. Awesome. Yeah. So she was told that, straight to her face. This is all of 10 days after that surgery, which Julie pushed for. She wrote, when I was asking her about this, she said, there was never an apology. There was nothing. I'm a different person now than I was then, but I wonder still to this day, if she hadn't gone those nearly 2 weeks trying to breathe and keep her airway open, what would it have looked like? Did it do further damage on top of what had already been done to her brain? So she's left questioning for the rest of her life, what could have gone different if I hadn't been getting gaslit like this? Olive is doing great these days. My kids know her, they love her. We've hung out with them on doing advocacy work. But how do you get to be a badass advocate like Julie? How do you get to curbside the head of the ENT department in the hospital hallway and ask them to do surgery even though the rest of the crew is telling them that you're gonna kill your kid? We're gonna do it. And it's gonna start with recognizing the red flags. Fingers crossed you don't see this many of them all at once. We're gonna just talk about 5 of them. Number 1, a pattern of dismissal. Gaslighting is an overtime thing. It's happening as a pattern. It's not a one-off situation. If your concerns are repeatedly being ignored or minimized in the presence of objective evidence, I have pictures of my child bent completely backwards to keep her airway open. Oh, I think she's fine. That's gaslighting, okay? When a one-time dismissal, a failure to dig deep, that could just be a bad day. And that is human. And we allow for humanity in medicine because clinicians are not superhuman. But if it's happening consistently in a pattern across teams, this is a red flag. Just one. Oh, well, okay, we get 2 at once. That's fine. Shaming language. If you're made to feel belittled, ridiculed, the problem, you're going to be the one that killed your kid if you go through with this surgery. If you're asking for opinion, if you're asking questions, well, no, you don't need to know that. That's fine. Like, why would you want to be included in rounds every day? You know, this is, when James said that this morning, I was like, oh, that's a man after my own heart. Like, if they dare round on my kid without me, heaven help you. I did get in trouble one day because I was answering questions that the residents were supposed to be answering. So I was quiet after that. But if you're being belittled or put down because you're asking questions, radar should go up for medical gaslighting. If you're being isolated, gaslighting is a form of abuse, right? And abusers will isolate you to keep you under their control. So if you're being told you shouldn't seek a second opinion, if you're being discouraged from accessing your child's medical records, which is your legal right, this is a red flag, and it should spark for you. Inconsistent explanations is the next one. If you're being told multiple versions of events, events that you saw with your own eyes, events that you have documented one way, if stories are changing without a clear understanding of why the story has changed. Now, we may see something one way, and then we do further testing and we realize, oh, what we thought was this is actually that. That's not gaslighting. That's learning more about a situation. But if we see this and we do testing and it's that, and someone comes back and says, well, it's still this, you're being gaslit. Don't accept it. And this one is tricky because your gut can be wrong, okay? But it's there for a reason. If you're leaving an encounter feeling crazy, if you're doubting your memory, if you've written something down and you're going back and looking at it and saying, why are they telling me something different than what I wrote down? Radar should go up, okay? How are we going to advocate? Well, there's 2 tracks of advocacy. There's things we can do in the moment, and there's things we can do after an encounter. In the moment, again, we talked about this with insurance. This is a big advocacy tool, and it's very hard. So use your self-advocacy. Take a minute if you need it. Take some deep breaths, right? Stay calm. Stick to the facts. Here's what I'm seeing. Here's what the data show. Rather than, I think this, or I think that. It's, I'm seeing this. Make them explain to you why what you are seeing objectively is not true. Use I statements. Now this is your medical, your clinicians will have been trained in therapeutic communication. You can use it against them as well. Or, sorry, you can use it with them as well. I'm concerned about XYZ rather than, oh, you're ignoring this. The I'm concerned opens up the conversation where you're doing this is going to slam a door and it's going to bring someone's walls up and make them more defensive. These open-ended questions are going to be great. Make them explain their reasoning. Can you walk me through this? Can you explain this to me? I don't understand this. I need more information about this. And then also request documentation. Please include in today's notes that I requested, this piece of testing that you're denying me. Because if it's really something that should be done and they're trying to gaslight you into thinking that it shouldn't, get it in the chart. Ask them to put it in the chart. They're not going to want to actually have to document that they dismissed your concerns. There's a power imbalance, the hierarchy in the hospital, in the medical setting between clinicians and families. There's a huge imbalance in power. You have more power in the situation than the system would have you believe. Sit in it, use it. After a situation, after a visit, write down your notes. We should all have just notebooks or files on our phones or whatever it is, whatever works for you. Write down your notes. What was said, who said it, so you can refer back to it. If you're able, not all of us have communities or people that are right by us, but if you are able, bring a support person to your appointment. You can talk to the doctor while they take the notes. Seek a second opinion. It is your right, and if you're being told, no, you don't need a second opinion, no, we don't want to help you with that, seek it harder. Then again, follow up in writing. You can send a message. Everyone's got patient portals. How many do you have on your phone now? Like 7 or 8 probably? Send a message in the portal to the doctor, per our discussion today in clinic. So that way, even if they're refusing to put it in the note, you have documented how you experienced the visit and the interaction. Summarize your own understanding of the plan, any concerns that you have, and then the ball's in their court to actually explain that back to you. And then escalate if needed, but do it respectfully. Start calm, rev up when needed is typically the best way to deal and engage with this. You have your patient advocate. At the end of the day, your patient advocate is employed by your hospital. They are going to want to protect their own job and their own institution. Keep that in mind. They are not, I want to be very sort of thoughtful in the way that I word this. They are there to help you, but they may not give you the help that you need, if that makes sense. So there's also, you can ask for an ethics committee review. You can ask for the ombudsman. Not every hospital has them, but that's sort of another layer of where you can go when you have concerns that you feel are not being addressed. And then you're gonna build your network. This whole conference, this whole thing is about making these connections that are gonna serve you in your advocacy and in your journey with your child or yourself. Again, I love that we have adults with heterodoxy now. You're gonna find those allies that are gonna be on your side, right? Medical gaslighting won't always happen from every single provider in an institution. Julie had ENT on her side who was able to advocate with her for what Olive needed. So look to your nurses. Look, I am biased because I am one, but your nurses are so often going to be an incredible ally for you in translating your concerns to other members of the healthcare team. Ask to speak to a social worker. Ask to speak to the patient advocate. Find the clinician. My husband and I, there's a couple attendings here at Boston who were just incredible advocates for us during a really confusing time with Ethan here at Boston, and it was them holding that continuity through that really allowed us to to make sure he got care that he needed in a couple of really tricky situations. Prepare ahead. Again, as if you don't have enough to do with all of this. Like, I'm so sorry I'm putting more paperwork on your plate, but request imaging. Your child's chart, you can legally have it. You can keep look, do as I say, not as I do. Don't have 500 boxes of random papers in your closet. Make a system that works for you so that you can find the information that you need to refer to say, hey, we have this test result that shows this. Why are you saying that never happened? Or, whatever the case may be. Keep a timeline of events. If things are not adding up, write it down. The strength of the gas lamps is a lot harder to dispute when you have it written down in black and white. And don't do it alone. Burnout is real. It's a real issue that we're all going to deal with at some point. So build your network, reach out for support. There's an incredible organization. What are they called? Heterotaxy Connection. Check them out. You're going to find a crew of other parents who are just ready to support you and to come alongside you and to share their experiences. And hey, have you dealt with this? I guarantee you there's someone else who has dealt with a similar situation to what you're going through. Here we go. Ready? Here's what you're going to take away from this. Number one, you are not crazy. I want you to remember that. You're going to feel crazy sometimes. You're not. You are the keeper of your child's history. You are the keeper of their life in a lot of ways. Like you're the one who's on the front lines. You're not crazy. Don't let people think you are. Tell you are. Don't ignore the red flags. It is exhausting to do this journey and to consistently have to fight for the best for our kids. Maybe you get lucky and everything goes smoothly, but that's not really the reality for most of us, right? Don't ignore the red flags, even if it's tempting to just sit back and sort of take a back seat for a little while. Recognize them, call them out, and remember that your advocacy can shift care. It's not for nothing. This is a kid, this one's mine. His hair is not pink, and so you might not recognize him in this picture. But this is a hospitalization after one in which there was a lot of medical gaslighting that happened, and he underwent a lot of unnecessary suffering as a result of it. And in this hospitalization, I didn't let that happen. And you can see he feels a lot better about it.